And go.
Good afternoon, class. My name is Normanda, and
My name is Pascal.
And today our presentation is about cardiac catheterization. What is cardiac catheterization? It's an interventional procedure used to diagnose and treat certain heart conditions and to evaluate chest pain. Doctors can treat coronary heart disease during catheterization with a procedure called angioplasty. During the angioplasty, a tiny balloon is put through a catheter and into the blocked artery. When the balloon is inflated, it pushes the plaque against the artery wall, which can restore the flow of the blood through the vessel. And just to give just a little bit more additional information, when the coronary arteries are narrowed or blocked, oxygen-rich blood cannot reach your heart muscle. So that can cause angina. And that's a chest pain that you receive, which is a little bit of pain and discomfort that occurs when that oxygen-rich blood is not flowing properly.
Why is catheterization needed? Many people who have partly or completely blocked coronary artery. This disease is called coronary artery disease, CAD. Also called coronary heart disease. It is a condition in which plaque or blood clots build up inside the coronary artery. This plaque is made up from fat, cholesterol, cardio, and other substances found in the blood. When this fat deposit build up in the artery, the condition is called atherosclerosis. This artery supply your heart muscle with oxygen-rich blood.
And also, CAD is the most type of heart disease, and it is the leading cause of death in the United States for both men and women. So you have to make a lifestyle change if you have coronary artery disease. And our procedure is percutaneous transluminal angioplasty. And this procedure is done in a sterile field. It is used to unblock a narrow or occluded artery within a vessel using a catheter. And the transfemoral approach is used with the arterial sheath catheter and accessed in a I'm nervous. Okay, it's all right. Through the thoracic aorta by a catheter. The guiding sheath is placed into the orifice of the intended coronary artery, and a guide wire is introduced through it and into the artery. It is then passed through the area of narrowing, and the angioplasty catheter is placed across the stenotic area. And basically, we passed out a brochure, and it's showing the actual different arteries that are blocked, and it's showing different procedures that are done in the cath lab. And here it shows we have the wires that are used. I can pass this around. This is the guide wire. And this is the actual balloon and the stent. And I deployed it so that you can actually touch the stent. And the balloon, we didn't deploy the balloon. And this is the injector that they use to inject the saline and the contrast. And this is the contrast media, busy page or omni page.
Patient preparation. Before patient undergoing catheterization, the patient may have undergo other long invasive diagnostic tests such as electrocardiogram and blood work. Patient need to give the physician or the nurse a complete list of all the medication such as non-steroidal anti-inflammatory drugs because they can cause blood clots. Diabetic patient who is taking insulin should also inform the physician. If the patient has an allergy to shellfish, the patient should inform the physician because it contains iodine or dyes commonly used in control agents. Patient is instructed not to eat for at least 6 to 8 hours prior to the procedure. Patient may be given a mild sedative before the procedure to help relax the nerves. A local anesthesia is given to the patient. They may also give morphine to help manage the pain. They can be given Vased to help sedate the patient. The assets are also clean. The asset is also clean with antiseptic solution and shade also. So
and this is the percutaneous transluminal angioplasty. And here, I don't know if the light is moving, you can see the catheter entrance, and then as it goes up through the aorta, and it's either the right or left coronary artery that is going to go into the access to to unblock that artery.
Contrary here. The most basic contract used in catheterization is opaque containing organic iodine solution. This is opaque, one of the ones we use, and this opaque. Depending upon the patient's disease, if the blood urine nitrogen and the serum container level are too high, this opaque, which is this one, is used because it is less painful.
And this is basically pictures on here, the cath lab. This is the nurse here that's monitoring the patient with the heart monitor, the blood pressure monitor, just making sure that the patient is, okay during the exam. And this is the basic room to see on the monitors for the doctor to see where they're gaining access and going through the coronary artery. And this is an actual procedure being done. You can see that the patient is slightly awake during the exam. Again, to see on both doctors. And you can see here, this is a normal arteries of the heart, and here is a narrow artery.
Indication. One of the indications is chest pain, heart attack, abnormal prenatal test results, shortness of breath, and several aging. So the contradiction, bleeding, infection, damage to the vessel, allergic reaction to dye, gastrointestinal bleeding, fever, and death.
And this is our video. Probably doesn't have any sound, but I can walk you through it and tell you what they're doing. Okay.